What exactly is abnormal psychology? According to the American Psychological Association, abnormal psychology is the branch of psychology that deals with psychopathology and abnormal behavior. More simply put, it delves into the study of psychology with a focus on atypical behaviors, emotions, and thoughts, which could be indicative of a mental disorder. To quote from a textbook on abnormal psychology by Ronald J. Comer, it studies the nature of psychopathology, its causes, and its treatments. Distinguished by its focus on the extraordinary and distinct from the usual, abnormal psychology explores the non-conforming aspects of human psyche. As Carl Jung once stated, the most terrifying thing is to accept oneself completely. And this discipline does precisely that. It's not just about what's deemed normal, but focuses more on the abnormal. In the words of Dr. Gerald C. Davison, a renowned abnormal psychologist, abnormal psychology is about individuals, their behavior, and mental processes that in some ways are not understood by general society. By shedding light on these deviations, it allows for a profound understanding of the human behavior. As a field, it constantly challenges defined norms, providing an intriguing journey into the human mind. This fascinating field strays from the norm or average and delves into the unusual, the abnormal, and the extraordinary. Abnormal psychology considers the nature of psychopathology and its causes, and this understanding can be applied in clinical contexts to treat those suffering from these conditions. So, what are some of these conditions, you might wonder? There's a wide range of disorders that fall under this umbrella. Anxiety disorders, for instance, involve excessive worry or fear. Mood disorders, such as depression and bipolar disorder, affect a person's emotional state. Schizophrenia and other psychotic disorders involve distorted thinking and perception. Personality disorders like borderline personality disorder involve long-term, rigid patterns of thought and behavior. These are just a few examples among a myriad of mental health conditions. So let's delve deeper into the definition of these disorders. The Diagnostic and Statistical Manual of Mental Disorders, or DSM-5, is the key player here. How did it come to be? The DSM started off as a humble guide in 1952, evolving through multiple editions to reach its current fifth version, the DSM-5, released in 2013. Each new edition incorporated advancements in clinical knowledge, research, and understanding of mental disorders. The DSM-5 is a comprehensive guide utilized by health professionals around the globe to classify and diagnose mental. It offers a thorough set of criteria for each disorder, comprising descriptions, symptoms, and a variety of other factors. Now, it's important to mention another system, the International Classification of Diseases, 10th Revision, or ICD-10. This system, while serving a similar purpose to the DSM, differs in several key ways. ICD-10, created by the World Health Organization, has a broader scope, encompassing both physical mental health, while DSM-5 is solely focused on mental disorders. Moreover, the ICD-10 is more extensively used internationally, whereas the DSM-5 is primarily used in the United States. However, the DSM-5 offers far more detailed diagnostic criteria, making it a richer resource for psychiatric diagnosis. Thus, the choice of which system to use often depends on the professional's specific needs and context. The indicators of abnormality are diverse and complex. They can include experiences of distress, disability in important areas of functioning, and increased risk of suffering. In addition, indicators can also include unusual or extreme behavior, inconsistencies in thoughts and emotions, and an inability to function effectively in daily life. Furthermore, a loss of freedom in certain aspects of life can also be a sign of abnormality. Remember, these indicators are not definitive. They simply provide a broad framework to help understand and identify potential mental health issues. So how common are these disorders? It's estimated that nearly 1 in 4 people globally will be affected by a mental or neurological disorder at some point in their lives. That's quite a significant number, isn't it? The treatment options for these mental disorders are diverse, varying greatly depending on the specific condition and its severity. These therapies can range from psychotherapy, medication, to a combination of both, and in some extreme cases, hospitalization may be required. Psychotherapy, also known as talk therapy, is a way to help people with a broad variety of mental illnesses and emotional difficulties. There are different types of psychotherapy that can be effective depending on the individual's specific disorder. Cognitive behavioral therapy, for instance, is a popular one. It helps patients identify and change thought patterns that lead to harmful behaviors or feelings. Dialectical behavior therapy, on the other hand, teaches patients how to manage their emotions, tolerate distress, and improve relationships. Medication is another pillar of treatment. These are not a cure, but they can help manage the symptoms of many mental disorders. Antidepressants, anti-anxiety medications, mood stabilizers, and antipsychotic medications are some of the types that have proved to be beneficial in specific cases. In some instances where the condition is severe and the patient is at risk of harming themselves or others, hospitalization may be deemed necessary. Hospitalization can provide a safe and stable environment for the patient, facilitating intensive therapy and close monitoring of their condition. It is usually considered when a patient cannot take care of themselves or when they need 24-hour care to stabilize their condition. All these treatment options are typically tailored to the individual's needs, and often a combination of treatments is employed to manage mental disorders effectively. To wrap up, abnormal psychology focuses on unusual patterns of behavior, emotion, and thought. It encompasses a wide range of disorders, from anxiety and mood disorders to personality and psychotic disorders. The DSM-5 is the tool used to classify and diagnose these disorders, using a set of criteria for each condition. Despite their complexity, mental disorders are quite common, affecting nearly a quarter of the global population at some point. Treatment is tailored to each individual and can involve psychotherapy, medication, or both. Abnormal psychology is a complex and fascinating field that continues to evolve as our understanding of the human mind expands. It reminds us that what may be considered abnormal is simply another facet of the diverse human experience.